What would you consider to be your ideal career? My ideal career is nursing. I'm going to tell you about what nurses do and what the job opportunities look like for them. Nurses, number one, they treat. They treat injured patients. They do a lot of wound care and one-on-one care, and they determine subjective and objective data. And if you do not know what subjective data is, that is the things that you can't see. That would be things such as if a patient comes in and tells you, well, I've had a fever for so-and-so days. That would be considered subjective data. Objective data is something you can see. The patient's heart rate is fast, or their breathing is really fast or really slow. That would be considered objective data. And they obtain this data in order to help the physicians. They also help the disabled. They help them to do activities of daily living. They help them brush their teeth, get dressed, do simple tasks like brush their hair, or just be there to care and comfort them in their times of need. They also teach. When your trip at the ER has ended, or your stay at the hospital has ended, the nurses do things like discharge teaching. They tell you about the things that you need to do to better your care at home so that you don't have to come back to the hospital. They'll teach you things such as using pill containers that individualize your medications into separate days. They teach you things such as how to care for a wound. If you've just had a broken arm and had to have surgery, they teach you how to go home and take care of that. They also teach you how to care for yourself. Maybe a person comes in and doesn't know that if you have a UTI, the continuation of a UTI could be a problem such as wiping from back to front. Well, the nurse will teach them you need to wipe from front to back. You need to do it appropriately, that way you don't get a urinary tract infection. Nurses also provide safety. They know CPR. I think this is the person I would want if I was ever to have a heart attack other than a physician. I would want a nurse to be there to help me through this, to save my life. They comfort the patients. They are there if a patient needs to cry. They are there if a patient is just having a bad day. They work in mental institutions where sometimes patients aren't in the greatest mood, or they're just coming down off drugs or alcohol or not doing so well at all. In nursing magazines, in an article called What Nurses Do and Don't Like, 82% of nurses reported working extra hours, with most saying those hours have increased in the past year. This is an underestimate of that. I think more than 82% probably work overtime. You see nurses at the hospital overworked and tired and just ready to go home at the end of the day, and some of them really do. So be compassionate to the nurses you see in the hospital. They're really needing it potentially that day. Now that I have told you what nurses do, I will tell you about the different levels of education and job opportunities available. The different education levels start with your CNAs. Your CNAs do basic tasks. They do ADLs. They don't really do anything more than that. LVNs, they require a year of training, and they can do things like wound care. They can take stage 4 decubitus, which is a pretty good size wound, and you can stick your finger into it and sometimes even your fist, and they can clean that out and debride that and make things look a little better and smell a little better, definitely. Next is your RNs. They require a little bit more education. They require you to have 1 year of prerequisites before you can even get into the program. After you get into the program and you have stopped your prerequisites, you can go on to the RN program, and it is about a 2-year program if you have no experience, such as no LVN background. And then you have your BSN and your Master's of Science in Nursing. Those are each 1 year after the other. So if you have your RN, you go 1 more year, you'll get your BSN, and 1 more year after that, you'll get your Master's of Science in Nursing. Employment of a registered nurse is expected to grow by 22% from 2008 to 2018. The job opportunities available are hospitals. Hospitals, you do a lot of medication passing at the hospitals. You do a lot of comforting at the hospitals. You also have your home health, where you go to someone's home who can't make it to the hospital or doctor's office and treat them or teach them or help them, aid them in their activities. And then you have hospice. This is for dying patients, and you can comfort them. They have what's called comfort kits, and you can give these to them when they're on their deathbeds. And also nursing homes. This is when someone needs to be helped for a long period of time, and you help them with activities of daily living. You help them get dressed. You help them get up in the morning. You help them bathe themselves, things of that nature. As the largest health occupation, registered nurses held about 2.6 million jobs in 2008. It's a pretty great number if you're thinking about that. This is a chart, and it shows how much nurses make. Licensed practical nurses make between $16 and $18 an hour estimate, and registered nurses make between $29 and $30. I've known some nurses that even made $50, which is pretty good, and the physicians make, if they're in private practice, about $86.50 per hour. So that's pretty close to this physician. I have given you the job aspects and told you about what nurses do. I hope to one day get my MSN and have my dream job.
I'm going to get kids out of the bedroom.
Okay.
They're taking out of the door.